Here is comprehensive, detailed information on deferoxamine. 1. Generic name, drug class, drug forms, brand name. Generic name, deferoxamine. Drug class, iron chelating agent, iron chelator. Drug forms, injectable solution for IM, IV, or subcutaneous use. Powder for reconstitution. Brand name, Desferol. 2. Definition. Deferoxamine is a chelating agent that binds excess iron in the body. It is primarily used to treat iron overload in patients who receive multiple blood transfusions, such as those with thalassemia or sickle cell disease, and in acute iron poisoning. It helps remove iron from the body by forming a stable complex, ferrioxamine, which is excreted via urine and bile. 3. Mechanism of action. Deferoxamine binds free iron, (queen), in the bloodstream and tissues, forming a stable, water-soluble complex called ferrioxamine, which is not metabolized and is excreted by the kidneys and in bile. This reduces iron-induced oxidative damage and prevents iron from depositing in organs such as the liver, heart, and pancreas. It does not bind iron stored in hemoglobin or cytochromes. Has a high affinity for ferric iron, E4. Indications. FDA-approved uses. Chronic iron overload due to long-term blood transfusions, e.g. in thalassemia major, sickle cell anemia. Acute iron poisoning, when serum iron exceeds total iron binding capacity. Off-label use, aluminum toxicity in dialysis patients by binding aluminum, forming aluminoxamine. 5. Contraindications. Hypersensitivity to deferoxamine or any of its components. Severe renal impairment without dialysis support, as drug and iron complexes are renally excreted. Acute iron overload not requiring chelation, i.e., when the patient can be managed by gastric lavage and supportive care. 6. Before taking this medicine, precautions. Inform your healthcare provider if you have or had kidney disease, since the drug is excreted renally, hearing or vision problems, risk of ototoxicity and visual disturbances, allergies to any medications, pregnancy or breastfeeding, safety not fully established. Infections. Deferoxamine may increase susceptibility to Yersinia or Listeria infections. Monitoring requirements. Baseline and periodic audiometry and ophthalmologic exams, renal and liver function tests, serum ferritin levels to monitor effectiveness. 7. How to use. IV infusion. Slow continuous infusion over 8-24 hours, often using a portable pump. Subcutaneous SC, common in home settings for long-term use, 8 to 12 hours. Intramuscular IM, in cases of acute iron intoxication. Instructions. Use sterile technique when preparing injections. Do not use discolored or precipitated solutions. Avoid rapid IV infusion, may cause hypotension and shock. NASH 8, dosing information. Chronic iron overload. Adults and children, initial dose 20 to 60 milligrams per kiloday, SC or IV over 8 to 24 hours. Dose adjusted based on iron levels and patient response. Max usually not to exceed 60 milligrams kilograms per day. Acute iron poisoning, adults and children, IV or EM, 1,000 milligrams initially, then 500 milligrams every 4 hours, or continuous IV infusion based on serum iron level and clinical status. Aluminum toxicity off-label, not 5 milligrams per kilogram IV during the last 60 minutes of dialysis. Note, dosing must be individualized based on iron burden and renal function. Chat 9. Missed dose, missed dose. Take as soon as remembered if within a reasonable window. Do not double the dose to make up for the missed one. For scheduled infusions, contact your healthcare provider if a dose is missed. Overdose symptoms. Hypotension, tachycardia, respiratory distress, seizures, reddish urine from ferrioxamine, shock. Management, supportive care, stop the infusion, possible dialysis in severe cases. Stop or avoid taking, discontinue or avoid deferoxamine if anaphylaxis or other severe hypersensitivity reactions occur. There are signs of vision or hearing loss. Serum iron levels fall below normal, risk of iron deficiency anemia. You develop Yersinia or fungal infections. Temporarily stop therapy. 11. Side effects in detail. Common side effects. Local injection site pain, redness or swelling, fever, nausea, diarrhea, muscle pain, skin rash. Serious side effects. Ototoxicity. hearing loss, tinnitus, monitor audiograms regularly, retinopathy, blurred vision, night blindness, especially with rapid IV infusion, renal impairment, acute respiratory distress syndrome, ARIS, with high doses, growth retardation in children with prolonged use, infections, increased susceptibility to Yersinia and fungal infections, allergic reactions, urticaria, bronchospasm, anaphylaxis, rare. Vital information. Urine discoloration, reddish, is normal and due to ferrioxamine excretion. Therapy may be lifelong in transfusion-dependent patients. Adequate hydration is essential during treatment. Ensure regular monitoring, iron levels, kidney function, hearing, vision. Do not take vitamin C 200 milligrams per day, while on deferoxamine can increase iron toxicity. Administer after dialysis in patients with kidney failure. 13. Other drugs will affect drug interactions. Potential drug interactions: vitamin C, ascorbic acid. High doses may increase cardiac toxicity when taken with deferoxamine. Prochlorperazine, increased risk of neurotoxicity when used with deferoxamine. Nephrotoxic ototoxic agents, e.g. aminoglycosides, vancomycin, cisplatin. Additive toxicity risk. Other chelators, like deferasirox or deferoprone, avoid combination unless prescribed, may lead to excessive iron depletion or adverse effects. Thank you. Have a nice day.